Hey, good afternoon. My name is Jeff Harrison, and you are on Your Personal Health along with Dr. Kim and Dr. Burris. Dr. Kim, Dr. Burris, welcome to the show.
Thank you.
How are you guys today?
Doing good. Yeah.
Hey, before we get started, I just want to ask you to do me a favor because you guys give so much. Can you just tell us a little bit about what you do for people that are joining us and what you have been doing with the COVID-19 updates and how they can continue to stay in touch? Just give us a little overview if you would.
So what we've been doing since the pandemic started is we've had a show before this where we talk about the numbers, and they're specifically for the Coachella Valley. We do bring in other relevant information from the U.S. and other places, but predominantly, what's going on in Riverside County, what's going on in the Valley, and our kind of perceptions and questions that we have and questions that people ask us so that we can give some practical advice.
Well, it's, I know that I'm thinking it's been like 14 months?
Or 14 years.
Months? Yeah. No kidding.
14, yeah.
Yeah. I read a book, and in that, in fact, even in the latest science, some kind of science thing, they said there's a projection that maybe we really are living in an artificial world. And I'm like, wow, who's the mastermind behind this? Why would they put it through this? Are they just testing us or what? So if you're listening, hey, come on now, the joke's up. Anyway, we've been going a long time, and I'm just wondering, because your profession, and this is not lowering the level of anyone else out there that's on the front line working hard, doing what they do, but I'm just curious how this last, however many months since this whole pandemic broke, how has that changed your industry? How has it changed your day-to-day in your practice? Or has it had any impact at all?
Actually, I think it's had a maybe a larger impact than I thought it would. I think at the beginning we thought, okay, we're going to get hit at the same time as New York did, and we were all sort of psyching ourselves up and feeling like there was this impending wave. And in my mind, I was thinking it would be like a 6-month ordeal, and then it would be over, with maybe a little bit of rumble after that. But really what happened is it turned into this really protracted sort of, bracing yourself for the next whatever. And in the healthcare industry, a lot of that had to do with the things that we changed were shutting down our normal activities. So a lot of the things that we used to do, you no longer have, like even from things like things that we do for ourselves, like a workplace birthday party or something like that. All of the nice and like sort of morale enhancing things are canceled. And we still have this pandemic, and we still have a lot of patient need. And then we have the added difficulties with communication, with some of our patients unable to access technology, people who suddenly could not get into their doctor. We've had difficulties obtaining PPE, which caused worsening stress, plus all the unknowns, like the unknowns of, am I going to get sick? Am I going to not be able to be there for my family? Is one of my kids going to get sick? Am I going to give this to somebody that I care about? How, and then the personal stuff on the other end, just like everybody else, finances and worrying about your children at home. And then sort of struggling to answer a bunch of questions that we didn't initially have any answers for. Mm-hmm. And I think that caused a lot of psychological stress on people. Sort of that combination of not being able to meet people's needs, not being able to protect yourself, and not having those types of stress relieving activities that we all use to sort of keep ourselves from burning out. I think that the health system as a whole is seeing a huge amount of turnover right now. And there's actually some, rumblings out there of like just the sheer numbers of hospital-based nurses and even the community-based doctors that are just kind of calling it quits or shifting careers, kind of backing off, going part-time. There's just really been, I think, much more of that type of effect on the healthcare system, just on people on a personal level, that really, the fallout of it, I don't think has been fully appreciated yet.
Dr. Kim, what are your thoughts? I mean, if we see, hey, when we drop a rock in the pond, there are those circles, and they have an effect, and it's almost like, hey, we don't think about that, but then we have an earthquake, and we have a tsunami on the other side of the world. Besides what Dr. Burris might have said, or any other things that come up to you to say, hey, thinking back what I was doing 14 months ago on a daily basis, and now what has changed. Or anything jump out at you?
Yeah, I think just like every other industry we've seen, a lot of our society is built on gatherings and group and social. Doctors' offices. You're seeing patients. You gather at school. Religious places, social clubs, and so when the pandemic hit, it threw a wrench into everything. And so the traditional model of medicine got hammered because it's based on how many patients you run through your clinic. And so I think that had a big effect on our industry. And there are a lot of doctors who probably had to close their office or retire earlier, or who had to do other things to generate income because patients weren't coming in, rightfully so, because we were in a pandemic. We decided to choose a model where it's not based solely on getting people in the door. And so we were able to, weather the pandemic, and we still are, pretty well, because we are able to provide, from day one when we opened, the kind of services that can weave and bob with things that occur, whereas other industries and traditional medicine is such a behemoth. It's like a Titanic that can't move quite as fast.
I think we are going to probably always feel like we should have a mask on for a few years. Yep. Like I had full PPE on the other day, and I had like my little cafeteria hat, and I had my N95. I had another mask over that. I had my face shield, my gown, my gloves. Wasn't wearing the shoe covers, but I was pretty covered up. And I remember feeling like normal. And when we started this, wearing all that PPE felt a little suffocating. And now when I don't have it on, I feel, at work especially, I feel a little like, maybe a little like something's missing. So to me, I've kind of made that mental shift to wearing a mask all the time. Not to say that I don't occasionally screw up. I almost walked into a store without a mask on the other day, and I thought, what?
Well, you're right. It is one of those things, like even today, as you mentioned, you were fully decked out and felt comfortable. Today, when I was filming a client at their location in a green room, I kept my mask on the whole time. I know they've been vaccinated, and I've seen them before, but I just for a moment I took my mask down because it was a one-on-one. I was trying to give the speaker, which is not always easy to do when you're filming on your own, to gather energy from the crowd, but I was trying to give him that. And in a very short period of time, I'm probably like 15 or 20 seconds, I put my mask back on because I felt uncomfortable with it off.
Right. And, I think that's, for those of us who've been diligent about wearing a mask, that's probably, a normal thing we've kind of adjusted to it. The good news is we'll adjust away from it when the time comes fairly easily too. It's gotten a lot easier to live with it.
Yeah. And it seems to be more readily accepted that it's okay if you're wearing your mask versus somebody points at you because you have a mask on. I'm curious about, as a day-to-day, you talked about, you both mentioned something that I feel like there's going to be a fallout. I'm just curious when we will probably feel that. Dr. Burris, you talked about, there's going to be the sheer numbers of drop off of hospital nurses and people in the medical industry are saying, hey, I've had enough, I'm done. Dr. Kim, you basically said, hey, there have been doctors who have, during this period of time, closed their offices. When will we start feeling that effect as the general public? I know we're already on a doctor shortage to begin with, before this ever started, as far as primary care physicians. What's your best guess of, hey, we'll start seeing this affect our normal medical processes?
I would say right now, because we're in this weird phase of the pandemic, it's hard to, feel the effect, because we go through these, closings and openings and what can you do? And people are still kind of in a urgent, I only think urgent things need to get taken care of. But I do think probably in the next year or two, when people start getting back into, okay, I want to get this addressed, I need this, and the machine starts going back to, the traditional medicine and everything going back to the way it used to be, I think we'll start feeling that, because then we'll feel the weight of, okay, it's getting back to 6-8 weeks of not being able to be seen. And, it's the whole, all the difficulty that revolve around getting as many people through the door as possible.
Yeah, I think we're starting to see it now. I'm starting to get people almost on a weekly basis saying either my doctor died, my doctor retired, my doctor had a horrible thing happen and quit. Like this, wow. Every week I'm starting to hear that, and I haven't had my blood pressure medicine for 3 months, or I haven't had a mammogram in 2 years, or wow. Whatever it is. So I think the vacuum is there, but people haven't returned en masse to their normal behavior. So I think over the next year, as people start to return, trying to come back into the system to do their normal routine care, that's when we're going to see the true lack of the doctors that have left this year. Because right now that is being obscured a little bit by the fact that a lot of people aren't going to the doctor for little stuff.
Yeah. It kind of reminds me of whenever we have this ebb and flow. I'm just curious now, as we move forward, how will we start to notice that? Will we walk in and it is a delay in getting an appointment? There are fewer people working in the doctor's office. There are even longer wait times at the emergency or urgent care. I mean, how will we notice this type of stuff?
Yeah, I think those things for sure. And then I think because we're a community that, a lot of people come and transition here, or they'll retire here, or they'll do things, they're going to have problems getting into seeing people, because if you're established, then, they won't turn you away. But there's a lot of providers, friends that we know, that no longer take X insurance, or don't no longer have open panels, and so it's going to be harder for new people to even find a place to.
Yeah, I think what happens, it's a pretty normal market force, but what happens is, in that kind of situation, doctors or other providers can become more and more picky about who they accept. So they'll only accept a few insurances that reimburse at higher rates, or they won't accept snowbirds, or, they can kind of pick and choose, because there are so many patients out there that they have the ability to do that. But what ends up happening is that people will then get insurance, and at the end of the day have no primary care doctor near them that accepts it. So this is already a problem with some insurances in the Valley, where people are finding that there's only 1 or 2 doctors that take it, and they're full. So I think we'll see this sort of happening on a larger scale over the next year.
Do you see this? Do you see this as an opportunity? You know, sometimes, you know, in the marketing world, we see a gap and we say that's not a problem, that's an opportunity. Do you see your type of medicine where it is more membership and so that we can get in when we want to, and I can take a picture of something and send it to you on a text and get some response? I don't necessarily have to walk into your office. Do you see your type of business with direct primary care? Do you see that filling that void, or do you kind of predict something else happening?
No, I think absolutely it can. The problem becomes is when we fill a void, someone else is losing out. And if someone else doesn't like losing out, that they're going to fight that. And so, you know, the void that's being left and the insurances that people have, but they can't see anyone. If they're coming to us, that means really the insurances aren't making money because they're not getting their portion of whatever they collect. And so I think there's going to be a battle of DPC and what it can fill, and forces that say, "Hey, we don't like you muscling in that territory."
I see.
I don't think.
Yeah,
I don't think we're enough of a threat at this point. I really don't. Because I think the bigger problem is the inability to meet the demand, and I think what we'll start to see is more of the care maybe being automated, so that, you know, you basically get a computer message to go get your labs. You go get your labs, and you get a computer readout or a voice message with, you know, explaining it. I think it's going to get more and more depersonalized as they try to automate more and more of it. I think that's the way that traditional medicine is going to go. I think you'll have fewer and fewer touch points with human beings. And I think that primary care especially is probably going to go to the lowest trained person they can get away with. So there's this perception that primary care is easy, but it actually is very difficult to take a big picture view, keep that big picture view in mind, and then be detailed about everything in that photo. So it is a little trickier than people think, and actually requires a lot of training, because you have to have a breadth of knowledge and have to sort of understand sort of what the pitfalls or risks may be with a large number of medications, et cetera. So I do feel like there's a huge need for what we're doing. There are some people who are going to be fine in a very automated system, especially if they don't have a lot of medical problems or they haven't had any. But when you get to a point where you're no longer simple, and you need someone who can give you a little more personalized feedback, I think that system is not going to meet people's needs.
Well, I think we're definitely in for some changes. It sounds like this. One last question, and by the way, I put the information on the screen. If you are a person who is, hey, you're here for a period of time. I know it's 100 degrees. It's not quite 100 degrees outside, but the snowbirds have typically started to leave now. But if you are somebody who's looking for a primary care physician for yourself, for your family, the information is on the screen. Coachella Valley Direct Primary Care. They're changing the way you stay healthy, and it is a membership program, and I'll have them talk about that a little bit. But as you're moving forward, this is a great alternative. If you are somebody who says, hey, I don't want to wait weeks to get an appointment, and I want to have personal touch with my doctor, then this is an opportunity to join one of these programs like Coachella Valley Direct Primary Care. And the number is 760-642-5549, or just go to their website, CoachellaValleyDPC.com. And quite frankly, you can go back to their website, or their YouTube channel or their Facebook. And if you want to know more about them, you'll learn a lot about them, not only professionally, but personally. They're wonderful people. They are caring. Obviously, they're in a position and a profession. They want to help others. I think you'll enjoy seeing what you see there and getting to know them. But before we go, I want to ask you a question. We talked about the negative side of what's happened since the pandemic, but like a coin, it has two sides. I'm curious now if you kind of think, hey, what are the positive things that have happened because of the pandemic that will help the medical industry going forward perform better?
I think one of the things we found out is that we don't need as many face-to-face touch points across the medical spectrum to get the same outcome, meaning that, heart attacks didn't jump up because people didn't have access to the ER. People aren't getting sicker overall, and so I think we've learned that some form of telehealth is acceptable and probably appropriate in some certain situations. And, I also think we've learned that most people don't have the quality of time that they probably should have, whether it's individually or with your physician, because as a family, we had to slow down like everyone else, but that was a good thing. I think, we've been able to spend time with our kids that we wouldn't have because life was going, a million miles an hour like everyone. And so I think, being able to slow down and to feel more connected because at least in our bubble and I think going forward, hopefully, society won't get back to the frenetic levels that we were at. But, it's really just, 5-minute interactions versus, appreciating more of the longer term to connect with people.
I think another thing that I really hope we keep with us is the understanding of how important each person in a health system is, and that the people who are essential are not just the people at the top, but they're people at every level. So the person that runs the lab, the person that cleans the bathrooms, the person that prepares the food, all of these people are necessary and important and should be cared for and protected within any institution. And that we are only as good as the protection that we give to that person. So to me, I think that was a really good lesson, that we need people in every position, and there's no one position that's expendable.
Great points. Hey, before I let you go, do me a favor, just give us a rundown of what your program is. I'll put the information on the screen as well. We talked a little bit about it's a membership program, and the information is on the screen now of how they can get a hold of you. But tell us a little bit more about the program.
Yeah, so we wanted to really focus medicine back to kind of being able to care for patients and having that relationship. And so direct primary care gave us that ability where we can respond in a timely manner. We can think about each patient in a way that, tries to help them navigate the system. It allows us to enjoy interactions, and we get to know our patients and they get to know us. And I think there's, something that was missing in medicine. And so, it's all you need to do is give us a call, or you can go on our website and get a free consultation, whether it's on the phone or you can come in, ask us questions, take a look, kick the tires. And this is something that, resonates with you, then we sign you up for the affordable fees, and it's $99 a month for age 0 to 45, and it's $145 for age 46 and above. And then we start making sure that we are keeping you healthy and kind of collaborating with you.
Fantastic. Well, guys, thank you very, very much. I really appreciate it. And if this is your first time joining us and this sounds like something, hey, you want to keep on top of, this is one of those programs where we're going to be able to come in, ask them questions, Dr. Burris and Dr. Kim, and really get some answers. It's not like a WebMD, but it is one of those programs where They're here to continue to serve you. And keep in mind now, starting this week, we've gone to the COVID-19 update is from 3 to approximately 3:15. And then we start your personal help at approximately 3:15. And then we talk about things that are more relative to you, not specific to COVID. And we'll talk about that. So again, Dr. Burris, Dr. Kim, thank you so much for your time. Really appreciate that. If you have questions and you're watching this in a recorded session, please put your questions in the comments, and Dr. Burris, Dr. Kim will check that out, or someone within the organization will check that out, and we'll get back to you. In the meantime, I'm Jeff Harrison. Dr. Kim, Dr. Burris, thank you so much for joining us today.
Thanks, Jeff.
Thank you, Jeff.
Be safe out there. Bye-bye.